Seems the buzzwords these days are artificial intelligence. Lots of excitement, but also a lot of fear when it comes to your healthcare. Stanford's Chen explains the magic. You know, AI, artificial intelligence, are the buzzwords these days. And there's a lot of fear and apprehension in the medical field, health-wise. How do you address that?
I think there's reason to have anxieties that are very plausible and reasonable, but also a lot of reason to be optimistic as well. I would say it's a key tool as much as the internet was a thing and kind of changed all that world 35 years ago. That doesn't mean like the internet can take care of patients. No, humans take care of patients, but boy, is it a very important tool. It's going to change the way we do all of what we do.
How do you use magic in order to translate AI in medicine?
It's really hard to tell what's real now. It turns out magic requires a lot of empathy and engagement, and it's illusion versus reality, and having a very hard time telling the difference. Surprisingly amazing things can happen. And I realized that's what AI looks like in the past few years. But sometimes that illusion is very convincing, and sometimes that illusion is still very useful. We anthropomorphize.
Is that an SAT word?
It is totally an SAT word. I try very hard to remember. We attribute human qualities to computers. Oh, it has thinking, it has reasoning, it has empathy, it hallucinates. Like, no, it doesn't. It's a computer, it's a model. It doesn't think, it doesn't reason, it doesn't know, it doesn't understand. But it creates such a convincing illusion of these things. At some point, know the difference, but also know that you can use that in very useful and compelling ways. Watch close, you'll actually find it's actually just an illusion and more. Okay. Now they're into it.
You know, Jonathan, I can do magic too.
Really?
And I'm wondering how you explain AI at health conferences. We're in Vegas, baby. Time for you to hit the stage.
Yikes, I better get to work.
Work your magic.
Please welcome Dr. Jonathan Chen.
I'm literally a hospital physician. I'm in my white coat and scrubs that I think I have a blood stain here. Give me a second. Let me see if I can just clean this up for a second and make myself a little bit more presentable. Okay.
What do you foresee for the future of AI in medicine?
Humans are always going to be needed, but our roles are going to shift and adapt. I should hope we have less paperwork to do, but when you need a surgeon, like you just need a surgeon, right? But a video visit's sometimes good enough. Using it for consultation, drafting information, that's fine. Practicing counseling and reasoning, but it still leaves us to be in the position of like judgment, influence, responsibilities, a very different dynamic, a thing that a computer just doesn't do, no matter how smart the computer gets.
Who would have expected computer nerd from Southern California is now doing some shenanigans on the Vegas stage.